Hello, this is Dr. GERARD CUOMO. We're back here live with Oleg, our patient, and we're doing tooth number 14. Tooth has already had prior root canal as well as a core buildup. So we're going to pick this up now. We've already prepped the occlusal, the mesial, and the distal walls, and now we're going to move right toward the lingual aspect. Again, I'm going to have the patient go ahead and open up, Oleg, and I'm going to just come right in here. We'll try to get this recorded right through my mirror. So we're going to go indirect. Let's see what would be the best camera angle. That looks good right there. Perfect. And we'll just, again, we're going to stay somewhat tapered, but also parallel because anatomically we want as much dimension so we don't have to rely on cements. So I'm going to go to the depth of the enamel and some into the dentin itself. And just gradually connect the two planes. And just paint it in, literally just paint it in. It's got a nice chamfer on this burr. Labs need a nice chamfer to wax to. And we like to get it right to the level of the tissue. Alright, so bring that in a little bit more. And start developing a nice path. That looks good. And take it to the distal now. And we'll go back there and suction the distal. Looking good. And we're starting to develop that nicely. Got a nice taper to that. And it's looking good. Out, please. Probably can take just a little more on this mesial buccal, or excuse me, mesiolingual cusp. Right there. Of course, we're going to round all of our corners. Now we're going to do the buccal aspect. Bring the suction back in. About 4 minutes into it, I did the lingual. Now I'm going to go ahead and do the buccal aspect. So again, just stay parallel with our tooth. And I'm going to come in and just prep this in. And do the mesial buccal first. I think if you just follow the depth of the burr, you can't really come up short on thickness. So just stay with consistently with the burr itself, and you should be okay. Sometimes you can actually visualize some of the enamel as a guide as well. So here we can see consistently some of that enamel. We want to grab a little more thickness. Alright, so you can see the table now getting more narrow. That looks pretty good. I'm going to go further back to the distal. And just try to stay as parallel as you can. So full crown preparation, 14, finishing the distal buccal here. A little air on our tooth. Let's get nicely done there. We're going to enhance all this, but we're going to place our retraction cord next, so you'll get to see that right on this video. I like Siltrax 7. It comes with epi, and then we soak it in hemodent and we dry it out. So soaked in hemodent and then dried out. And just double check here. I'm pretty happy with our overall look here. We're going to get this distal corner just enhanced a little bit more. So far I'm very happy with everything, all the tissue areas. Somewhat a little bit red in the inner prox. We'll open that up a little bit more. We'll scrub it with Tubulacid next, or excuse me, with the cavity cleanser. Oh, look, turn a little bit toward me, please. Okay. There we go. Alright, cavity cleanser next. And I think before we place the retraction cord, I'm going to just adjust one spot in the prep. I like going back and forth with a couple of burrs toward the end, and I like the long chamfer at this point just to kind of get this line angle so I have a little more room to place my retraction cord. Again, I'm staying pretty conservative because I really deal with the age of the patient and also the position of these teeth. A little air on that tooth, please. Yeah. Okay, great. Now we can put that cord in there. And what I do is I just take out enough of the cord. I make sure it's super dry. And sure it is. Just double check. And we'll dry our tooth off. Great. Alright. Click track 7 is a braided cord. You okay, Oleg? Gonna feel a little pressure. Usually, if I give him enough anesthetic on the buccal, on the lingual, I'm just barely going under the tissue. It's a non-anesthetic zone. I'm just gonna pack cord gently. Let's get it going. And I'm moving it toward the tooth, pushing toward the tooth, not straight down, but in, because there's an undercut in this zone. That's where the papilla has to heal itself. Right now it's irritated and inflamed. He just had his teeth cleaned right before this appointment, so that tissue is going to look better. We're going to try to get him to water pick that area. And we have a little tip that we'll introduce in the final series on this video recording. And we'll also introduce this little thing called a microsuction tip. It's actually a 25 gauge blunt end syringe needle. We've just learned to adapt it to our procedure here. So I'm going to continue to get this packed all the way around the tooth, and then I'm going to trim the two ends so they meet end to end here. Then we tuck the whole thing in together, and that cord will stay in. As we tell our patients, it's a little string that goes under the gum tissue, stays in there till we're finished with the procedure, and then we pop it out at the end after we cement the temporary. It's kind of neat. Controls any bleeding, and it isolates the area, keeps it very clean. Yep. And just got to pull this through now. Come on. Alright, so get that micro suction tip in there next. There we go. Get a chance to look at our tooth now. So you could see this little bottom right here, we got to make room there, and in here channel this a little better. Okay. So we'll move down in there with our instrument. Let's see if I can grab it. Sorry about that. Okay. That's great. They're good on both ends. Now we'll finish this prep. We'll bring in our handpiece. And we'll come out for a second, please. And again, we're just going to refine drying the tooth now. And we're just following this corner. Just polishing, literally just polishing the margin. And I'm just going to go ahead and polish this margin. And I'm really not putting much pressure at all, just gently massaging and adjusting slowly You know, it's just sanding basically the margin. Alright, now I'm going to fix the buccal and lingual aspects, but I'm going to pick this up again on the third video. So that's next. See you then.